Sleep. Sleep. Yes. Sleep. Imagine waking in the morning slowly, the light at the edge of your eyelids, the blanket still warm. You reach for your phone, then glance at your smart ring. A gentle buzz, a soft glow. The app opens, 42 minutes of deep sleep, an hour and 20 minutes of REM, a sleep score of 91. Excellent recovery, it says. You close your eyes and feel reassured. Validation in a number. Now imagine the same night, but under the bright fluorescence of a professional sleep laboratory. Wires run like tiny tributaries from adhesive pads on your scalp. Sensors rest on your chest. Clips measure your breathing. A probe monitors oxygen. Bands sense muscle activity. Tiny cameras track your eyes. The technologist whispers instructions. The room hums with machines. In the morning, the lab report reads differently. Altered REM, different amounts of deep sleep, unexpected awakenings, a sleep architecture that doesn't match your ring's summary. So who's right? The elegant little ring on your finger, or the room filled with electrodes and monitors? That question leads to one of the most important lessons about modern wearable technology. Knowing what your device actually measures is often far more valuable than the numbers it produces. Every day, millions of people wear smart rings, watches, and fitness bands. These devices have become our daily sensors, feeding us sleep scores, readiness metrics, heart rate variability, stress estimates, and tailored recommendations. For many, they are the primary window into personal health. Yet most people never pause to ask something critical. How does my ring know I'm asleep? And how does it decide whether I was in REM, deep, or light sleep? To answer that, we need to start with the gold standard in sleep science. Polysomnography, PSG, the formal sleep study. If you've ever had a sleep study, you know it feels nothing like wearing a ring. In the lab, multiple biological systems are measured simultaneously. Electrical brain activity, eye movements, muscle tone, heart rhythm, breathing patterns, oxygen saturation, body position, limb movements, sometimes even carbon dioxide levels. Most importantly, clinicians place electrodes on the scalp to record EEG, the brain's electrical conversation. This is a crucial distinction. EEG measures activity of the organ that creates sleep, the brain itself. Sleep scientists identify REM by spotting characteristic electrical patterns and rapid eye movements. They identify deep sleep by the presence of slow-wave activity. Awakenings and arousals are seen as abrupt shifts in cortical activity. In short, the classification comes directly from the brain. Your smart ring, however, cannot read your brain. It has no scalp electrodes, no EEG. Instead, it must infer sleep indirectly from signals it can access. Most modern rings and watches rely on photoplethysmography, or PPG. The device emits a tiny pulse of light, and often infrared or green, as into the skin. Blood vessels beneath the surface absorb and reflect that light differently with each heartbeat. By tracking those minute changes, the device estimates pulse waves, heart rate variability, and sometimes respiration and blood volume changes. Put simply, the ring isn't watching your brain, it's watching your blood flow. That's a clever approach because the cardiovascular system shifts predictably across sleep. Heart rate generally falls, HRV patterns change, breathing slows and deepens, body temperature shifts, movement decreases. Over time, patterns in these signals tend to correlate with different sleep stages, but correlation is not the same as direct measurement, and that distinction explains much of the disagreement between wearables and sleep labs. Imagine trying to infer what movie someone is watching. One method is to sit beside them and watch the screen. That's EEG. The other is to stand outside the house and listen for laughter and the cadence of voices. That's PPG. You might guess the genre correctly, but you're still making an educated inference rather than reading the source material. And that's exactly what sleep algorithms do. They look at physiological clues and compute the most likely sleep stage. Modern machine learning has made these guesses increasingly sophisticated. Algorithms analyze heart rate, HRV, motion, breathing-derived signals, skin temperature, previous night's patterns, and even large population data sets to make probabilistic classifications. For many tasks, these systems perform surprisingly well, particularly when the job is simply distinguishing asleep from awake. Wearables are generally good at estimating total time asleep, sleep onset, and wake times. They can detect broad patterns. Did you sleep more or less than usual? Did your sleep time shift earlier or later? Where things become more difficult is sleep staging, differentiating REM, deep, slow-wave sleep, and light sleep, especially brief awakenings and micro-arousals. Those states are defined by brain electrical patterns and subtle eye and muscle activity that a ring cannot directly observe. Sometimes the same cardiovascular pattern can occur across different brain states, and that ambiguity leads to misclassification. Movement artifacts add another layer of complexity. Imagine you roll over, adjust your blanket, scratch an itch, or reach for water in the night. Those movements can temporarily distort sensor readings. The algorithm must decide, was that a full awakening? A minor repositioning or normal nocturnal movement? The answer is not always obvious, and errors happen. Heart rate variability is another powerful but complex signal. HRV changes with sleep stage, stress, alcohol, illness, exercise, hydration, and breathing patterns. The wearable may measure HRV accurately, but then map that HRV pattern to the wrong sleep stage. In those cases, the raw physiological data can be correct while the interpretation is imperfect. This is also why different wearables often disagree with each other. Differences in sensor type, placement, light wavelength, sampling rate, algorithm training data, and the weighting of signals can all change the output. Population biases in the training datasets, age, skin tone, health conditions, can also influence how well an algorithm performs for different individuals. Because of these limitations, sleep researchers increasingly advise focusing on trends rather than obsessing over single-night metrics. One night's deep sleep estimate tells you very little. 30 nights of consistent patterns tell you something meaningful. Ask different questions. Did your deep sleep drop after a night of alcohol? Does your HRV trend upwards with better stress management? Do you consistently fall asleep earlier after exposing yourself to morning light? Those long-term patterns are the true power of wearables. It's also important to remember that sleep labs are not perfect either. A lab captures a single night in an unfamiliar environment with wires and cameras attached. Many people experience the first night effect, sleeping differently when observed and in an unfamiliar setting. By contrast, a wearable can collect data every night for months or years, producing rich context. That longitudinal data, even if imperfect night to night, can reveal trends that a single lab night cannot. The future is unlikely to be wearable versus sleep lab. It will be wearable plus sleep lab. Clinical EEG gives you the exact story of brain activity. Wearables provide the long arc, how that story changes across weeks, months, and years. Together, they give a fuller, more actionable picture. But there's an important human side to all this, the psychology of sleep tracking. For some people, morning sleep scores become grades. Each night an exam, each dip an indictment. That anxiety, the constant need to optimize each metric, can worsen sleep itself. Researchers call this orthosomnia, an unhealthy obsession with perfect sleep driven by tracking data. Remember, the purpose of a wearable is not perfection, it's awareness. The goal is to illuminate patterns, not to create new anxieties. One bad night does not ruin your health. The human body is resilient. Use data to inform gentle changes. Consistent bedtimes, light exposure, exercise, alcohol moderation, rather than to demand immediate perfection. At Oxyzen Health Intelligence, we like to say, data becomes valuable only when interpreted correctly. Raw numbers alone don't improve health. Understanding and context do. If there's one lesson I want you to take from this episode, it's this. Your smart ring is not measuring sleep the way a sleep laboratory does. It estimates sleep through physiological echoes, heartbeats, breath, movement, temperature. Sometimes those echoes give remarkably accurate insights. Sometimes they lead to imperfect interpretations. But when used thoughtfully, with attention to trends, context, and human experience, wearables can be extraordinarily powerful tools, not because they replace medical diagnostics, but because they reveal patterns that would otherwise remain invisible. The future of health is not about collecting ever more data. It's about knowing the strengths, limits, and meaning behind the data you already have. I'm Dr. Yendi. Thank you for joining me for another episode of Oxyzen Health Intelligence. Remember, your wearable isn't reading your brain. It's listening to the echoes of your biology. Sometimes those echoes tell an important story, and I'll see you in the next episode.